Thank you, Dr. Mohit. A privilege to be a part of this group. I've really enjoyed this session and really learned a lot from everybody. I was a little delayed because there was a board meeting and I was on the way. That's why I kept my screen off and reached home by 3:30. So thank you very much for inviting me to be a part of this. Missing Dr. Dilpreet and wishing a very speedy recovery to his father. So communication errors form a very important part of the reason why some patients may be unhappy. And this has been highlighted by several speakers. Dr. Manish spoke about the myopic patient who was unhappy because he no longer could see for near as he has always been doing, or the trust deficit that was referred to earlier. So all these aspects form a very, very important part of patient satisfaction. So let us look at communication. Let's first see what communication implies. So when we talk about communication, what is important to see is that it is imparting or exchange of information, both by speaking, writing, or any other medium. So there are multiple media involved. The communications, verbal is an important aspect of it, as we all know, but the non-verbal aspect of how we communicate is equally important. How much attention we give. Do we have eye contact when we talk to the patient? And do we do that occasional encouragement or patting or hugging to our amma to really build that confidence, which is becoming a difficult and problematic thing these days. So that is again a two-way exchange. So as in any other communication, it is important to hear what is not being said. The body language of the patient is important, and body language that the surgeon or the entire team has, that is again important. So what does the communication do? Communication helps us better understand people. This is the most important thing. And it helps us build trust and respect. So these two are some of the most important aspects of communication, which we all do in our own ways, in which we deal with patients, in the ways we have taught our teams to deal with the patients. But when we understand the importance of this, we do it better. Again, empathetic listening is very, very important. Listening is the key to communication. Now, what this quotation says, the biggest communication problem is we do not listen to understand what is being said. We are listening because we are getting ready to reply to what is saying, framing our answers at that time. And we are missing out on some of the other things that are being said while making a statement which may not clearly be stated. So now coming specifically on to what communication needs to be with a cataract patient, we can consider it as preoperative, intraoperative, and postoperative communication. But again, emphasizing lack of communication is what leads to a lack of trust, which leaves room for doubt and creates the problems. The preoperative communication is not just what our people, our staff, and we speak. It is a lot to do with the rest of the things as well. The ambience, whether it appeals to the patient in terms of being caring. It doesn't have to be lavish. It doesn't have to be 5-star, but it appears caring, where the people are attentive, people are willing to help. That kind of ambience is important. The displays all around, which may talk about the surgical techniques available, the intraocular lenses available, and the choices in different kind of situations, they may all be important in communication, besides, of course, what we as individuals deliver to the patient. So the communication is at the front desk, is by the optometrist who does the workup, the communication by the surgeon, and by the counselor that most of us have. So the communication preoperatively should do a very important thing of understanding the patient. You need to understand what his occupation, what his professional requirements may be, what his specific visual requirements may be, as we were talking about that myope. We also need to look at the personality of the person and deal with him accordingly and see whether he's an over-demanding patient. You also need to see amongst the attendants who's the decision maker, whether the patient himself or one of the attendants is the decision maker. And his background and relationship with the patient also make a lot of difference to how the decisions are made. So what we need to communicate includes not just the nature of surgery, but nature of disease, options in management, what preparations need to be made preoperatively, nature of surgery and experience during surgery, post-operative expectations, and financials. So of course, the important key is to communicate in a very simple, easy to understand way. And as Albert Einstein said, if you can't explain it simply, you don't understand it well enough. So you have to have the depth of knowledge to be able to communicate in simple words. Consent is a very important part, but informed consent has to be very specific, very detailed. It has to be individualized for each surgery. And of course, appropriate documentation is the key. This has been emphasized in several talks today. Under promise, over deliver. If you ever promise the moon, the patient will definitely be disappointed. It is also important during the surgery to put the patient at ease with reassurances, explain the likely experience, explain what you expect the patient to do, and a word of appreciation during and after the surgery. These go a long way in building the trust and a relationship of mutual support. The communication should also be post-operative with regard to his experience and discomforts that he may have, post-operative precautions that he needs to have, and some of your staff, if they inquire about their welfare telephonically, goes a long way in enhancing the patient experience. And availability of one of the staff for SOS calls or difficulties that may arise. Now let us we've looked at what the communication should be. Now let us look, where do we go wrong? One of the major things is that we don't develop that relationship. Our communication, even if we are very busy, amongst the staff, there should be somebody who's communicated enough to build a relationship of trust. Second aspect is inadequate assessment of patient's personality, his expectations, his requirements, which is very important. And if we do not give adequate information on all aspects. Also, the patient, if he expects post-operative chair time, that needs to be given to him. So if these are the 4 areas that are taken care of, then we generally would have a relationship which would go a long way and would not result in unexpected legal challenges and so on. But the biggest bugbear often is unrealistic expectations, which again goes if we understand the patient and if we do not overpromise. So let's look at all these. So developing that trust or developing a relationship can be a long-term thing. The patient and the family have been coming to you for a long time. They've seen that your dealings are trustworthy and uniform to everybody, and you give them enough time to develop that trust. This aspect, again, we have dealt with that. This includes his personality. His expectations are directly dependent on his nature, which you can judge during the meeting, and from the kind of experience that he's had earlier in his previous eye or anything else, which tells us what the patient's demand, what the patient's expectation at the end of the surgery is, whether he would like his astigmatism to be corrected, whether he would like an unassisted near vision or not. Those things need to be assessed adequately. This is very easy explanation. Information needs to be as complete as possible, including possible complications, and just the written complications do not suffice. When anything happens, the patient would definitely say that he needs to have been explained this better. So as we say, the single biggest problem in communication is the illusion that it has taken place. Sometimes we assume that this is understood, which doesn't happen. And this is what George Bernard Shaw said. So don't ever assume that this goes without saying and this the patient does understand. We must state out all the things. And nothing helps more than post-operative explanation and chair time. So to conclude, appropriate communication is absolutely the key to having patients who will trust you, who will remember you, who will come back to you again and again. Thank you very much.